Dr. Madanji, you can start.
Okay. I, Dr. Madanjit, on behalf of Gurugram Gynecologist Forum, welcome you all for this very interactive and very interesting and integrated program about, role of traditional medicines in, especially in obs and gynae, more so in infertility. We have our guest speakers, Dr. Dinesh Katoch and Dr. Preeti Chhabra and Dr. Rajvi Mehta and Dr. Shalini Chawla. I extend apologies on behalf of Dr. Ritu Jain, who might shortly join from US with us. So for my audience who have joined in, Dr. Rajvi Mehta is PhD in human IVF. She has over 3 decades of researcher experience in clinical embryology and training. She's a joint treasurer of the Academy of Clinical Embryologists. She's convener with Indian Fertility Society Special Interest Group on Holistic Medicine. It is the holistic medicine for which we are here today. She's also consultant to Cooper Surgicals, India and Trivector Biomed. She's editor of magazine Yoga Rahasya for past 27 years. She's an author, Imagine If Stories of Ordinary People with Extraordinary Grit. Yoga teacher at Iyengar Yogashraya, Mumbai. And she's also part of the team which designed International Yoga Day, Common Yoga Protocols. And now introducing a guest speaker, Dr. Dinesh Katoch. Sir is senior CMO in CGHS. He's got 40 years of professional experience in the field of Ayurveda. He's national advisor to World Health Organization for strategizing traditional Indian medicine and homeopathy. Has represented India in many international delegations. So I'll be introducing my rest of the speakers later on, handing over to Dr. Rajvi Mehta to start the fundamental principles behind Ayurveda with Dr. Dinesh Katoch. Prior to that, traditional medicines, we all know what is traditional medicine. It is, as per WHO, it refers to health practices, approaches, knowledge, and beliefs incorporating plant and based medicines, spiritual therapies, manual techniques, exercises applied singularly or in combination to treat, diagnose, and prevent illness or maintain well-being. Different traditional medicine systems are Ayurvedic and Siddha, homeopathic, Unani, and Chinese medicine system. So we'll be more dealing with Ayurvedic system today. And why we are here is for the holistic medicine, because a common healing doctrine of medicine is that man assists, but nature heals. And that's what we as allopathic practitioners also want. And traditional medicine people, or the alternative medicine we call it now these days, do help us in achieving our goals. Over to you, Dr. Rajvi.
Thank you. Just a minute. So thank you, Dr. Madanji, for inviting us, and the gynecologist, Gurugram Gynecologist Forum for inviting us for this very, very interesting and different kind of a meeting. The whole idea is that I would like to start with a quote from Rudyard Kipling, which says, "East is east and west is west, never the twain shall meet." But the world has proved him wrong. Geographically, east and west cannot meet, but in reality, the world has become a village, what we call as a global village. And although when we talk of 2 different systems of medicine, whether you call it traditional, whether you call it complementary, they come from different backgrounds. So in India, we know now for the last 8 years, we have this entire system and a Ministry of Ayush, which is the Ministry of Ayurveda, Yoga, Unani, Siddha, and homeopathy. Of these, I may say that yoga is actually not a science of healing or therapy. Yoga is a science which is dealing with the integration of the individual with the universal. However, to reach on that path, one does need health, one does need healing, and it becomes a part of this Ayush system of medicine. I am not a scholar of Ayurveda or traditional medicine. I am a practitioner of yoga, but I do know that we have these 3 systems. Ayurveda, Unani, and Siddha. And as far as I understand, Ayurveda dates back thousands of years. And even in the same lineage comes in the Siddha, which possibly the texts are more in the Tamil language, whilst we have the Unani, which is considered of Greek origin. But somehow it is believed that all of these have their roots in Ayurveda. So the idea of this forum is that although Rudyard Kipling said that East and West cannot really meet, and like Dr. Dinesh Katoch once said, that these two systems of medicines are like two banks of the river. They may not really meet. But the fact remains that both banks of the river nourish people living on either side of the river. And that is exactly whatever the system of medicine, the objective is to help suffering mankind, to heal them. And that is the reason this entire forum and this entire dialogue has been set up. So the idea of this dialogue is that we, the modern medicine practitioners, often, and I'm quite candidly saying, are often skeptical about these traditional medicines. We feel whether they do have a role in the current scenario. On the other hand, the approach of traditional medicine is totally different. And they wonder that why should a system of science, which has existed for 2,500 years or more, needs to give evidence today? If it was not functional, it was not working, it would have died its death. We wouldn't even be discussing it after so many thousands of years. So the idea is, how do we come to the same platform? And that is the reason I'm really going to be discussing with Dr. Dinesh Katot. Thank you, Dr. Dinesh, for actually joining us. He is really a scholar on this subject who has also played a very big, important role in policy making and possibly understands how the science is perceived and what all the science has to offer mankind. So good afternoon, Dr. Dinesh. A few starting words before we start the dialogue with you.
Okay, thank you. You're not audible.
Yeah, maybe you can just say a few introductory remarks and then we can start our discussion or all my questions to you.
Okay. First of all, thank you very much to the organizers, particularly this Guru Gram Gynecologist Forum, for inviting me to participate in this webinar and share my thoughts about Ayurveda. Dr. Rajvi had very rightly said, and she quoted one of my statements that we are two sides of the rivers, two banks of the river. We can see each other. We can try to merge. But the objective today is that we need to develop live-in relations. We need to develop live-in relations for bridging the gaps in the healthcare. And I think this infertility, I think it is a very very important area where the medical fraternity, the healthcare fraternity, they need to work upon. In the last 43 years of my professional experience, I worked at different platforms, initially as a teacher in Ayurveda college, then in central government as a physician, Ayurveda physician, then in the central government for policy making and planning and technical advice to the government, and then at the WHO level. What I have seen that the traditional medicine, the so-called traditional medicine, it is seen from a very different perspective. It is seen from a very different perspective. But we need to understand that the epistemology of the traditional medicine and the epistemology of the modern medicine, or the so-called the conventional system of medicine, these are entirely different. The concepts are different, fundamental principles are different, and the approaches are also different. What I personally feel that the so-called the medical system, the Western medical system, or this allopathic system of medicine, I feel that this system should be considered as a medical system, the system for the medical care. But whereas the other systems of medicine, means these traditional systems, they are basically meant for healthcare. healthcare, means care of the life.
Okay.
Okay, they are also used for the treatment of the diseases, for the management of the diseases, but basically they are meant for healthcare, means healthy living, and to take care of the life, all aspects of life, whether it is a physical aspect, the social aspects, the psychological aspect, and the spiritual aspect. There are many dimensions, but one thing which is common in all the traditional systems of medicine, including Ayurveda, that is the holistic approach and holistic dimension to life. So with these, I think I would request Dr. Rajvi that whatever she has in her mind to ask me, she can start asking.
Okay, sir. So firstly, thank you. I have a lot of questions which are my own and which often my colleagues who are in the field of modern medicine, infertility treatment, often share. So it's going to be a very candid kind of question, something which may appear even trivial, but these are certain ideas which are, bubbling in people's mind. So first question, in a very simple, sir, to ask somebody who's been in the field for 43 years, to ask you to explain in layman's term, what exactly is Ayurveda?
Okay, I think the word Ayurveda itself explains itself that what Ayurveda is. Means Ayurveda, the lifespan, the life, and the Veda means the knowledge. So the knowledge system about life.
Okay, that's a very...
And when we talk about life, it means the health and the disease and the management of the disease. So all these aspects means that the health, the disease, healthy living, and if the person is diseased, how that person can be managed or treated. So all these dimensions are there in Ayurveda, and the if you see the evolution of Ayurveda, I think the roots are in the...
Sir, you have got muted. Sir, you have got muted. Yeah, we lost you. So, yeah. Sir, we can't hear you. Sir, we can't hear you. Can the others hear? I can't hear. Dr. Madanji, can you hear him?
No, we can't, Dr. Rajvi.
Yeah.
Is muted.
Sir, we can't hear you. Sir, your mic has gone. No,
Hello.
we can't hear. Yeah, now we can hear you. Sorry, we lost you when you were talking about the science of life and health.
Okay. No, this Ayurveda means, as I said, that the word Ayurveda itself explains the meaning of this term, the Ayurveda. It means the science of life, or the knowledge about all aspects of life. No, the basic material about Ayurveda, if you see, you will see the Vedic literature, particularly the four Vedas, where we have the ancient wisdom and the ancient science. So the Vedas, they are replete with references related to health, related to disease, and the treatment of those diseases with the natural modalities, right? And some of the modalities, they are drugless, like praying, and then the mantra ucharan, or there are different mantra like that. But the systematic documentation of Ayurveda principles, Ayurveda concepts, I think that happened around 3,000 years back. And the first compendium of Ayurveda, the first and the foremost, that is Charak Samhita. Charak Samhita is the oldest documented information about Ayurveda, and this book document has 120 chapters. Hello.
Yeah.
Hello.
Yeah, we can hear you, sir.
So this book basically it is about the philosophy of medicine, the philosophy of medicine. No doubt, the clinical application of that knowledge that is also there, but the philosophy of medicine. Uh, Sometime I wonder that why we say that this is allopathy or this is traditional medicine or it is the modern medicine like that. If you see the books of medicine, they nowhere mention, they never coin that it is allopathic medicine. Medicine is medicine. Medicine is medicine. The approaches for applying that medicine that could be different. The approaches for diagnosing the patient could be different, but the medicine is medicine. That is why some of the things which were there in the traditional medicine, again I would call is a so-called traditional medicine. Actually, the traditional medicine is the real conventional medicine.
Okay.
That is conventional for the communities which they use. The communities which they use that system of medicine or that discipline of medicine. Once I think I was in a WHO meeting in Hong Kong. There once I think a professor of medicine, I think from UK, he put a question that what is the basic difference between traditional medicine and the so-called conventional medicine? Like in India, now in India, the Ayurveda, I think Ayurveda is a conventional medicine.
Okay.
Rather, the modern medicine, the so-called modern medicine, or the Western medicine, it has come from outside, and it is an alternative system of medicine for us.
Okay. So
This is the
everything
thing.
goes to terminology of how one looks at it. It's all about perception.
So the terminology is also very confusing terminology. Some they call it alternative system of medicine. Some they said that a complementary system of medicine. So it is not like the medicine is medicine, and the principles, the fundamental concepts, and other things, epistemology, etc., that could be different of the different systems. So this now the first compendium of Ayurveda. That is Charak Samhita, written around 3,000 years back. And then the second, that is mainly for the surgical procedure for the surgery, that is Sushruta Samhita. And then based on these two documents, another compendium that came out again, I think that was in the 1000 BC. Or rather at the I think 2000 years back, that is Ashtanga Sangraha and then the Ashtanga Hirdaya. These are the three major books, and we call them as Brihatrayi, the big compendia. And then there are small compendia like Sharangdhar Samhita, Madhav Nidan, and the Yoga Ratnakar. These are the three other books which were written, I think, in the 9th and 10th centuries. So all these 6 documents, the compendia, they have adequate information about health, about disease, about the use of different natural modalities of healthcare or the medical care, whether the plant origin products or the animal origin products or the mineral origin products or the marine origin products. So all these things are there.
Okay, sir. So now that you have said that the entire science is based on 2 or 3 major texts, and the Charaka Samhita going back nearly 3,000 years and the Sushruta Samhita going maybe 2,500 or so, I'm talking like a skeptic. So please pardon me for that. But the question comes in, how valid are these texts or today? And secondly, are these texts subject to interpretation? Because, they are sutras which may be very terse, which may have a meaning. And would the interpretations vary with time of how one looks at it?
The exact interpretation remains the same, but the perspective changes. The perspective has changed over the years. Now, if you see many of the remedies or many of the principles, I think, which were not clear to the medical fraternity or to the Ayurveda practitioners, no, they have like I'll give you one example, like this for the treatment of fistula in right? So there is only one line statement with regard to the treatment of fistula in Sushruta Samhita, that Kshar Sutra. Kshar Sutra means that is a medicated thread. that is tied around the pile mass, and the pile mass that gets shedded. Right? It is removed. I mean, that is a exact surgery. It is a parasurgical techniques. So that medicated thread is tied around the pile mass, and within a week's time, because of chemically induced, because that some chemical, alkaline chemical, is there in that medicinal plant, and from that alkalinity, the necrosis of that pile mass happens, and it is removed. It is surgically removed. There is no need of any hospitalization. Only some local application of some decoction or some medicated oil that is done, and that without the use of antibiotics and the anesthesia. That is now. So all these things have been validated. Like if you so, I think 25 years back, not 25, I think more than 30 years back, there was a study. A multicentric study in ICMR and then the PGI Chandigarh, GPOMER, about this Ksha Sutra. It is now this Ksha Sutra treatment. This is considered just like sit-on therapy. Sit-on.
Okay.
And some doctors are there in All Indian Institute of Medical Sciences. They also do that. It is an improvised technique. So many of the therapies, they have been not only the therapies, even the formulation, even the drugs, those have been improvised scientifically. Now, I give you just one example, like turmeric. The wound healing properties of turmeric, they are mentioned in Ayurveda and traditionally used for many years, centuries. Now, out of turmeric, now the curcumin has been derived.
We lost you for a moment. Are you there? Okay.
It's a phytoconazole, but wholesome ingredients, not the phytoconstituent, not the derivative, not the isolate.
Okay.
Right? So now when the scientists, they started working on curcumin, they did not find the same results as we find with the use of turmeric.
Okay.
Because the principle of synergy of different ingredients or different elements present in the plant itself, I think that is lost when we isolate that phytoconstituent.
So, right? Yes, sir.
So
when you say that, it is a synergistic principle that works. So it is very much dependent on the use of the entire plant product, whether it is root or stem or the leaf, instead of isolating the active principle. The question now comes in that possibly when the Ayurvedic texts were written, the plant origin. So if you've taken the example of turmeric 50 years ago, turmeric 1,000 years ago, turmeric 2,000 years ago, wouldn't it have undergone, with everything changing, would it still retain the same properties, or to some extent would they also get, do you feel that they would have got affected if you are not looking at an acute active principle, because it loses its synergistic effect?
Over a period of time, you can say the biological activity of these ingredients, plant ingredients or the plant materials that have changed, because it all depends upon the geoclimatic conditions, the soil conditions. So many factors are there. The time of harvesting of the material, and then the chemistry of the soil. Like the chemistry of the soil of Madhya Pradesh is different as we have in Delhi. So all these factors, they influence. But now a range has been fixed. That is there in the pharmacopoeia. Now in the pharmacopoeia, we have around standards of 1,000 medicinal plants ingredients. So those standards are fixed.
Okay, so then this variability is no longer as much. Yes, sir.
Now the availability again, that is a challenge. That is the issue, because previously in the past, most of the plant material, it used to come from the forest, from the wild sources, right? Now the demand is so huge, so means we are not meeting that demand from the forest sources. Now the cultivation has started, but again the problem is that many of the medicine plants, like the tree species, now the gestation period for the tree, that is around 10 years, 15 years, because after 15 years, if we sow that plant today, after 15 years we will get the material from that plant, like the bark or the other things. So but the efforts have been made by the government. Now since 2000, that National Medicinal Plant Board, that has been set up by the government, and that board is promoting cultivation of the medicinal plants, large scale cultivation of the medicinal plants, whether these are herbs or shrubs or the annuals or the biennials or the tree species. And I am happy to convey that I think almost 30% of the plant material which is used in the Ayurveda, Siddha and Unani medicine, now it is coming from the cultivated source.
So can we understand that when they're coming from a cultivated source, there'll be a lot of similarities between the plant products and not the bio variability, which is one of the major problems. So just to give an analogy, when we use gonadotrophins for stimulating women, we've had a problem using human menopausal gonadotrophin, which is from urinary source, because of the extreme bioactivity and biological activity and variability. So people have switched to recombinant, so it is very much controlled. So in that case, do you find that, yeah, sir, can you hear me?
Please.
I think, yeah. Can you, because your video has frozen, sir. Dr. Katoj, can you hear me? Your video seems to have been frozen. Yeah, I can hear you, but we can't see you. Dr. Katoj, are you there? Your video has frozen, sir.
Hello.
We can hear you. We can hear you. Dr. Madanjit, you can hear me, right?
Yeah, I can hear you. I can hear Dr. Katoj as well.
Hello.
Sir, but his
Yeah,
video
we can
is...
hear you, but possibly he cannot hear me.
Dr. Rajvi, you are not audible.
No, I am, sir. Maybe just can you check?
Yeah.
We can hear you.
We can hear you, sir.
We can hear you. Do you want to log in again, sir? Oops, you've lost him. Sir, do you want to log in again? Sir, do you want to log in again? Yeah, can you log in again, sir?
Hello.
Sir, we can hear you. 1 second, I'll just. Can you, sir, we can hear you. 1 minute, I'll just call you, sir. Sorry, he has some problem with the video, so he's reconnecting. So just give us a moment.
Hello.
Yeah, we can hear you. Can you hear us?
It is okay now?
Yes.
Hello.
Yeah, we can hear you, sir, but your video is not on, but we can definitely hear you. So we can continue in case you can hear me.
Hello.
Yeah. Sir, you are audible. Yes, the video is also on now. No, the video is also on. We can hear you well. We can hear you and we could see you. I think that's it. Yeah, can you now? It's all. Yeah, it's okay.
It is okay?
Yes, we can hear you. Sorry about that. Now we are clear. So, sir, we were talking about.
You are not audible to me.
Oh,
I could not understand what the questions you are putting.
Now can you hear me?
Let me switch again.
Okay, can you just log in again? Maybe that's better. Yeah, please log in again. So while we have Dr. Katoch coming back in, he's for those who joined in late, he's a very senior Ayurvedic practitioner over 40 plus years. He has been involved in teaching, then he has been practicing and is involved in research. And primarily, he's also in a big way in policy making with the WHO and the Ministry of Ayush. And we have been talking to him about the use of Ayurvedic medications. And more so, we have been talking with reference to modern medicine and how we are often, I would very candidly say, a little skeptical. So what he has told us is, Doctor, just see when he joins in, we can, yeah. So what he has just told us is that Ayurvedic medicine does not work on isolating active principle. It primarily works on using the entire plant product, so be it root or stem or flower or leaf, but not isolating the active principle. And I think this is where it strongly differentiates from modern medicine, where we actually go in using a pure active product. So again, going back, since it's a gynecologist forum, if we were wanting to support the luteal phase, we get interested in using progesterone, and that's what we use. However, the corpus luteum would be secreting multiple substances beyond progesterone. So that is what Dr. Katoch has been talking to us, that it's the synergistic effect of multiple. And he gave the example of turmeric, stating that turmeric as a whole has been known for a long period of time to be very useful in wound healing, as an antibiotic. But when one isolated curcumin from turmeric, it did not show the whole properties. So this is where we had these technical glitches. We stopped. So Dr. Katoch, I hope I'm audible now.
Yes. Audible
Okay.
and visible also.
Okay. So now that we were talking about the product, there's a question that has come in from the audience that, or rather from Dr. Ritu Jain, who's the president of the society, that when so much of soil is contaminated with pesticides and water is also not from proper sources, how is the quality check of the biosource done? So when we are using medicinal plants.
As I told that now we have the pharmacopoeia, and in the pharmacopoeia for each ingredient, for each drug, we have the permissible limits of heavy metal, permissible limits of pesticides, microbial load, and the aflatoxins. So all these is well defined in the pharmacopoeia, and accordingly, it is mandatory for the industry to make use of only those ingredients which meet the standards, right? And if you see the Drugs and Cosmetic rules and the provisions of the Drugs and Cosmetic Act, it is mandatory to follow the pharmacopoeia, the standards given in the pharmacopoeia.
Okay. So that way,
even if some of the ingredients which do not find standards in the pharmacopoeia, now it is mandatory that they will have to generate in-house standards, and then those in-house standards along with the testing methods, those should be made available to the regulator, so that only then that formulation or that ingredient is approved for use.
Okay, so this way we are taking care of the raw materials to a great extent.
Right.
And at least it is within the limits. Now we go to the formulation of any kind of a drug. The question is that, many of the substances or material which would have been referred to in the Charaka Samhita or the later text, would they still be available today? Or
Yes.
have they been regenerated?
Today we have three different kinds of formulations. Number one, the generic formulation, or the so-called the classical formulations, which are well documented in the classical text. We call them as a Shastriya Yoga. Shastriya means the classical. And if you see the first chapter of the Drugs and Cosmetic Act, where the definitions are given, the classical medicine, what is Ayurveda medicine? They say that Ayurveda medicine is that medicine which is made in accordance with the formulae given in the authoritative books of Ayurveda, and the list of those authoritative books of Ayurveda that is in the given in the first schedule of the Drugs and Cosmetic Act. So 57 books of Ayurveda, they are listed in the Drugs and Cosmetic Act, and the different formulations which are given in the, like Chavanprash. Now Chavanprash, it has 48 ingredients, right? So it is a multi-ingredient formulation, but this formulation is also standardized. It is given in the pharmacopoeia. standards of the Chyawanprash are given there. The standards of the ingredients are also given there. Even in the different Ayurvedic texts, the formulation under the same name, they have different composition, slightly different composition, but that has also been standardized, and that is given in the Ayurvedic formulary of India. So formulations, the composition of the formulation, that has also been standardized, and that is given in the Ayurvedic formulary of India. And I think more than 1100 Ayurvedic formulations, means the old formulations, the classical formulations, those are standardized, their composition, the method of preparation, right? Everything is standardized. Now, there is another set of formulations, which we call as the proprietary formulation, or the so-called new formulations. New formulation, new combination, like LEAP 52, or any other formulation, proprietary or the branded product, right? This is another category of Ayurvedic formulations, and the regulatory guidelines are there in the Drugs and Cosmetic Act, that what kind of evidence is required with regard to safety, efficacy, and the quality of that product. It is there. The regulatory provisions are there. Now, another set of formulation is that the formulations are old. The formulations are traditional, but those formulations have been made for particular indications, for specific use. If you see the uses in the authoritative books of Ayurveda, the uses are quite different. Like Chyawanprash, we say that it is for kasha swasha. Now, what kasha means in the modern scientific terminology? So that has also been defined, and that is also validated also.
Okay.
As I told you that in case of turmeric, turmeric, they say that, okay, it is Vran Shodhan. Vran Shodhan means it is antiseptic now. No antiseptic effect, no, that has been validated, that has been proven. Right. So
Yeah.
now in the today era, the biggest challenge is purposing and the repurposing of the Ayurvedic formulations.
Okay.
For the indication, for all those indications, for all those uses for which we have the conventional allopathic medicines.
Okay.
Like, I give you one example, like Trifla Churan. Trifla, I think you might have heard, might have heard of Trifla.
Yeah.
Now, Trifla, if you see the classical books of Ayurveda, it is not mentioned for diabetes, because the word diabetes is not there.
Mhm.
Right? We call it as a prameha or the madhumeha.
Mhm.
Right? Now, after scientific studies, series of scientific studies, and because the practitioners, in accordance with their Ayurvedic wisdom, they make use of Trifla for diabetic patients, right? And now it has now it is proven that Trifla is also hypoglycemic. Okay. But to put the term hypoglycemic on the level of Trifla, the scientific studies are required. Some scientific evidence is required. So that provision is also there in the drugs and cosmetic rules, that for the new indications, or for the new uses, or for the specific purposing of the drug, Ayurvedic drug. So that is also possible. So
Okay.
this is the thing.
So now you've taken you mentioned Trifla and you mentioned diabetes. Now, diabetes, definitely India is going to be the capital, world
And
capital of diabetes.
same thing happened with regard to this COVID, because COVID disease is not mentioned in Ayurveda.
Absolutely.
But the simulating features, clinical features, on the basis of that, the Ayurveda practitioners, they diagnose the patient, and accordingly, the formulations which are mentioned there, they are being used. And now when those formulations were studied, they found to be useful in COVID illness.
Okay. So coming back to diabetes, which is of great interest, not only to the general public because it is the #1 disorder. Second thing is that in the field of infertility, in the female infertility, PCO is on the rise. And we do have a large number of women with insulin-dependent, non-insulin dependent diabetes. Are there enough studies done which talk about efficacy, or it actually able to regulate and control? Are there enough scientific blinded or controlled studies available, or are they, as far as your knowledge, happening
With
anywhere in the
regard
world?
to fertility, as well as with regard to this
Diabetes specifically, or
contraception. Some studies are there, but the Ayurveda fraternity or Ayurveda practitioners, they make use of their formulations just on the basis of their Ayurvedic diagnosis and on the basis of the recommendations as given in the and one thing is, I think it should be very clear to everybody here that the Ayurveda approach of treatment, it is not merely based on drugs. The role of drug in treating a patient, in managing a patient, it is 25%. There are other interventions, the lifestyle interventions, certain do's and don'ts, the precautions, and the dietary modulation, the other things are there. And the 4 pillars of treatment in Ayurveda are, number 1 is Nidhan Parivarjan. Nidhan Parivarjan means avoidance of the predisposing factor and avoidance of the precipitating factors, the etiological factor. Second is the elimination therapy, which we call as detoxification or the purification therapy, or the so-called the Panchakarma therapy, which we call as Shodhan Chikitsa. Means the morbid material which is causing the problem, that material has to be eliminated from the body, right?
Okay.
Because that morbid material is not allowing the normal functioning of the system or normal functioning of the any particular organ or any particular tissue, right? So that this is the second pillar of treatment. And the third is that is the drugs that we call as a palliative treatment, Shaman Chikitsa. So the role of Shaman Chikitsa means the role of drugs, that is hardly 25%. And the fourth 25% is, I think, that is do's and don'ts. आपने देखा होगा, you might have seen that when the Ayurveda practitioner prescribes a certain combination or a formulation, he also gives lot of advice, what to eat, what not to eat, what to do, what not to do. So many precautions or the do's and don'ts, they are prescribed to that. And that is very important, because the treatment in Ayurveda, that is individualized. If you are suffering from headache, I am suffering from headache, the same pill will not work. Even if the same pill is to be given, it will have to be given with a different combination. If suppose you are having a headache, and if your temperament is different from mine temperament, then you might be given that pill with the hot water, or I might be given with milk.
Okay.
So the treatment is individualized. And why this is individualized? Because the person as a whole is being considered. Person as a whole, the temperament of the person as well as the temperament of the formulation, both are considered. Means not the temperament, I can say the nature.
Okay.
The nature.
Okay. So actually, since you talked about Panchakarma, there is a question that comes in from Dr. Ritu that, today with the popularity of Ayurveda, we have centers across the streets giving Ayurvedic treatment. There'll be a spa giving an Ayurvedic treatment. There's a Panchakarma center. And the question is that it is often practiced for so many diseases and for detoxification. We are worried about electrolyte imbalance and losing the gut microflora. So can you please see how to advise people? So it's not questioning the science or the treatment, but the way it is often being utilized today.
Mm-hmm.
So, because this is a concern, because left, right, center, people feel that, okay, let's undergo Panchakarma and we'll get cleansed. It is like Ganga mein nalo and, we are purified. So that kind of an attitude. So how do you handle this, and how do we feel that the gut flora and the electrolyte imbalance is not there? Sir, you're muted. You're on mute. Yeah. But again, we can't hear you. We can't hear you. Sir, we can't hear you.
On the mute page.
Hello.
Yeah, now we can hear you. Please go ahead.
So if this is a Panchkarma procedure means the 5 procedures. The one is MSs, therapeutic MSs. Then the therapeutic purgation. Then the anema therapy. Then the administration of the drugs through the nose, right? Then the bloodletting. So these are 5 different so-called detoxification procedures. But we don't call it that detoxification. We are the cleansing of the channels which are responsible for the transformation of the metabolites, right? So we regulate or we modulate those channels with the help of these procedures, right? Like now there are scientific studies are there, like in case of bronchial asthma, when this therapeutic MSs with the use of Ayurvedic drugs, when it is done, then the histamines, they are expelled, they are eliminated. So it's a sort of antihistaminic effect is there. Like, so this is the thing.
Dr. Ritu, does it answer your question, or would you like to elaborate on it?
Let me explain that.
Okay.
Because most of the centers means which are being run in the every nook and corner of the city. Most of the centers, the people go there for wellness. They are not going there for illness.
Okay.
They are going for wellness, just for relaxation. They are going for massage. They are going for Shirodhara. If they are not having proper sleep, okay, they will go for Shirodhara. If they are body stiffness, heaviness, okay, they will go for massage. So they are not going for that typical Panchkarma. They are not going for typical Panchkarma as advocated in Ayurveda.
Okay.
Right? They are going for wellness.
Okay. So in that case, I have another question. Today, there are Ayurvedic clinics which have opened all over. Hotels also provide Ayurveda. I mean, how do we know we are going to the right person? What is the normal process of education of an Ayurveda Acharya? Coming from the field of yoga, sir, I know that there are schools. Yeah. Yes, sir.
I think now it is very clear that who is a Ayurveda practitioner means only that person can become a Ayurveda practitioner who is registered under the Indian Medicine Center Council Act, and who can be registered, who has a recognized qualification. And what is the recognized qualification? The BAMS. Just like MBBS, we have BMS qualification. So no person other than BMS can be registered as only very few on the experience based, but their number is decreasing. Because since 1970, when this Indian Medicine Center Council Act was made, now the practice of Ayurveda, that is also regulated. Who can practice and how that practice can be run. So all the regulatory provisions are there. So the BAMS, that is the minimum qualification.
How long is the BMS actually, which is the Bachelor in Ayurvedic Medicine?
Same. The tenure of study is same as for MBBS course, 5.5 years. 4.5 years theoretical training, and then the 1 year internship.
But sir, now you talked of Triphala, for example, and people have heard about it. This is available over the counter, and I hear it is good. So unlike where you have a proper prescription, how safe it is to go and pick up and use it like self-prescription? Because there is nothing regulating their being available in the open market.
No, the thing is, I think there is a dilemma. There is a dilemma. And now the problem is, if you see the regulatory provisions for the drugs, the sale of Ayurveda, Siddha, Unani drugs, that is not regulated fully. The license is not required for sale of Ayurveda, Siddha drugs. Like in case of allopathic drugs, there must be the qualified pharmacist should be there, right? So this thing. Now, another thing is, as I told you right in the beginning, that the system is basically meant for healthcare. So most of the population, most of the people, they use Ayurveda products in self-healthcare mode.
Okay.
Without going to the doctor, without going to any hospital or to the dispensary. Like Chyawanprash. For Chyawanprash, the people know that what for Chyawanprash is. So they directly go to the shop, they directly go to the chemist shop, they purchase Chyawanprash, and then they start. Many of them, like in case of this Ayush Kwath, when this Ayush Kwath was promoted during this COVID for immunity boosting, I think many people without consulting doctor, and definitely they suffered from some side effects because they do not know in how much dose that is to be taken and with what anupan or with other material and when to take and for how long it is to be taken. I never knew this. And that is why these kinds of news, the bad news, they are coming from outside, from Europe, from America, that okay, they use this particular Ayurveda drug and the patient were having some problem, edema, like for this infertility. Many ladies, many women in Europe, in America, they use this Garbhapalaras of Ayurveda for sustenance of the pregnancy. But they suffered from some kidney problem, some because they never knew that okay, in what dose that is to be taken and how long that is to be taken. So I think the people, they should go to the practitioner, they should go to the hospital, to the dispensary, and then they take the consultation, and the doctor will prescribe that how long that medicine is taken, in what dose is to be taken, and which medicine is to be taken.
Okay. Sir, I have one question. I remember about a couple of years ago.
So presently, because of this regulatory provisions, the prescription-based drugs are very few. Prescription-based products, prescription drugs, and this is also one of the reasons that is why the Ayurveda products, they are exported to different countries in large amounts. Huge quantity of Ayurveda products that is being exported, but they are not exported as drugs. They are not exported as medicines, because in the importing country, the regulations, they do not fit into the regulations for drugs. In India, they are manufactured under Drugs and Cosmetic Act. They are manufactured under the provisions of the Drugs and Cosmetic rules, but they are going as food supplement, dietary supplements, self-health care products.
Okay.
And,
Sir,
even if these drugs are exported to other countries, but in that country, the Ayurveda practitioners are not there. The system is not recognized there. Then who will prescribe those drugs?
Okay. So, sir, I understand. Yeah, I understand this now. If you're using it as a wellness or as a supplement, you may be safe, but that also depends on the amount you take. And here I would like to, just for sake of just getting to see how the concept of quantity is there. And I would like to narrate an example of a friend who happened to visit India a couple of times and saw people consuming ghee. And somebody asked him what it is. So he asked somebody saying, this is ghee, it's very good for digestion, etc. But you have it in small quantities. You can't have more. 2 years later, when somebody visited him in California, the poor guy took it by word that you cannot have too much. So every day he would increase half a spoon, and he actually said with a bowl full of ghee. So the idea or perception of amount is very unclear. So I think the message that goes in from you is that if you want to take any of the Ayurvedic formulations or Ayurvedic drugs, it is important that you go to a qualified person who guides you on how to take them, when to take them, the quantity, etc. Now, a couple of years ago, there was a report from a young boy in his 30s who had problems with constipation and landed up in some spa. And he was given like some Ayurvedic, quote unquote, we don't know what was given, drugs, and he died suddenly. And when he died, the autopsy actually showed that there were heavy metals and there was toxicity. So there is this constant fear that, maybe they contain, maybe they don't, but there's a constant fear amongst all the modern, quote unquote, conventional, unconventional, whatever we call them, practitioners about these things. Was it a one-off event? Was it that the drug which was given to this was not under qualified under quality control? Yeah. So 1 minute, can you please? So is it something which was a one-off case, and this has generated a lot of fear amongst others? So it may not be the entire science. Maybe that person was not qualified, or maybe the drug was not right. But how do we? So would you like to elaborate? Because I'm sure you would have heard of that case because it was played up, and it's.
No, let me tell you that frankly speaking, we use minerals, we use metals in our formulations. But those metals and those minerals, they are not used as such. They are not used as such. Certain the pharmaceutical procedures are applied on those formulations, which we call as Shodhana and Marana, right? So the purpose of this Shodhana and Marana, these are the procedures, the pharmaceutical procedures, they help in making that ingredient therapeutically safe and effective, right? So like we also use mercury, we also use this arsenic in our formulation, but it is not in the elemental form. It's very complex compound form, very complex. Why mixing with certain herbs? Why subjected to certain procedures, pharmaceutical procedures, very lengthy procedures, and then they are rendered safe. And again, the standards of these ingredients, they are there in the pharmacopoeia. Bypassing of the standards, it could be there, right? But the most important thing is whether that formulation, which is having heavy metals or any mineral, whether that and these kinds of formulation, these can never be used in self-healthcare mode. Self-healthcare mode means self-medication. I think that is not advisable. That is not desirable. It has to be in consultation with the practitioner, because practitioner can decide or can guide the patient that, okay, in what dose, how long, and with what kind of other formulations it should be given. And there are strong recommendations in Ayurveda literature that how long the mineral-based formulations are to be used, right? Everything. So if there is irrelevant consumption of these formulations, definitely the patient, the person may suffer from some side effects, or even the fatal outcomes could be there.
If I were to summarize, I can say it is not the system to blame. It is not the drug or the formulation to blame. It is possibly the quality has been compromised by the manufacturer, possibly. And also possibly it is that the person who's prescribing it or self-medicating could have caused the harm. So which can happen if we go and take any of the modern medicine drugs on our own, surely we'll have problems. So possibly
No,
you would
madam,
say that.
I can say.
Yeah. Yes, sir, go ahead. Yeah, Dr. Ritu, you had a question.
I just
Yeah.
give you one example.
Yes, please.
Like in a case of CIA, no, water itself is a poison for that patient.
Okay.
Excess intake of water, that can also be fatal for that patient. The same is there. Same is here. The other morbidities, other morbidities, no, like we have one formulation, Laban Bhaskar Churn. It is very good digestive, very good digestant, very good appetizer also. But suppose if the person is having hypertension, so we do not advise that formulation to be given to that patient, because it has number of salts. Right? So same thing.
So,
okay, yeah.
Can I
Dr.
have a
The
question?
formulation.
Okay.
Yes, madam.
Yeah, Dr. Ritu,
Yeah.
go ahead.
With our modern medicine, there is a list of contraindications and side effects. So when you say that so many medicines are sold over the counter, so does all these medicines have that list of side effects? I usually don't see that list or some leaflet with the Ayurvedic medicine. Dr. Katoj, and is the medicine taken differently can cause side effects?
If you see the the precautions are there even in the drugs and cosmetic rules. If you see the schedule E1, schedule E1 is the list of those ingredients or those drugs which are basically poisonous in nature, which are toxic in nature, right? So all those formulations which are made from such ingredients, those have to be taken under medical supervision. Without the intervention of the doctor, those should not be consumed. So if a person is taking directly that medicine from the chemist shop and consuming it, I think that is not desirable, that is not advisable. And contraindications and the indication, both are mentioned in the Ayurveda literature for each formulation. Where to use and where not to use. And then the condition of the patient.
Yes, sir. Yes. But
Yes.
I think there is
And another important development which has taken place in the country for the last around 7 years. Now the pharmacovigilance for Ayurveda, Siddha, Unani, and homeopathy drugs, that is also there, and more than 100 centers in the country, they are working on that.
yes, yes.
Pharmacovigilance.
Thank you, Dr. Katoch. Dr.
Yeah, I
Go
think we
ahead.
can go on. Yeah, Dr. Pramila, you have a question, because I think it's a very interesting discussion and we'll need many more discussions.
Yeah,
Really
I'm
Yeah.
Dr. Rita Darbari. I wanted to come in. You see, I did during this COVID time, I did 6 months Ayurveda course. Primarily a gynecologist, but I have interest in so many things. So I don't know, Dr. Mehta, he was professor somewhere. He gave this thing. So as I understood the fundamentals of, जब हम खिचड़ी बनाते हैं Ayurveda or allopathy, there should be no खिचड़ी. Ayurveda is totally preventive, good health, having Ashtanga yoga, having 8 limbs. This is Ayurveda. And then comes allopathy. Allopathy is not basically preventive. Allopathy is treatment based, whereas this Ayurveda is preventive based. So this is the fundamentals we must first of all understand. We should not mix allopathy with this. There is a clear, this I understood. Now, because you are basically, Ayurveda is treating on the basis of 3, Vata, Pitta, and Kapha. These are the 3 varieties, and then depending on your this thing, am I right or am wrong? I want to ask Dr. Dinesh.
Madam, let me explain. Actually, Vata, Pitta, Kapha, these are not the 3 varieties.
No, these are the 3 natures of
No. If you see the fundamental principles of Ayurveda, the body is made up from 5 elements.
Yeah, that's right.
Panch
Tattva. Exactly.
जो है उन 5 तत्वों के साथ जब वाइटल फोर्स, जिसको हम कहते हैं आत्मा या चेतन तत्व जब मिल जाता है,
एग्जैक्टली,
तो वो जो लिविंग बॉडी होती है, और उस लिविंग बॉडी में जो फिजियोलॉजिकल एंटिटीज हैं, the physiological entities, they are known as Vata, Pitta, and Kapha.
Exactly.
And the structural entities, they are called as Dhatu, Ras,
Bilkul, Rakta, exactly.
Excretory entities, they are called as Mal. So, Dhatu Mal, those means the physiological
and Mal.
The body matrix that is made from the Dhatus, the 7 Dhatus, and we can compare these Dhatus just like tissues.
Yeah, exactly.
Excretory metabolites, we call them as Mala.
Mal. Yeah, that's right.
The balance of the physiological entities, that is important. Now the dimension of the physiology that varies from person to person.
That's right.
So within the physiological range, now the person could be a Vata dominant person. It could be
a Pitta or a combined also.
Right. It could be combined also, or it could be totally balanced, and we call them that a Tridosha or the Sanipathic.
Exactly.
These kinds of persons, those who are Sanipathic or the mixed, the balanced, so they never suffer from these common ailments.
Exactly. Okay. That's what I said, that these are different. We should never confuse. And
I'm sorry, I have to intervene because this is a very interesting discussion. But to understand Ayurveda in half an hour and 1 hour is literally, I think, expecting Dr. Katoch. We may ask you to join us again many times to educate us. Right. So I thank you so much. I had a lot of questions, and I think we'll have more forums. Yes, sir, the last word.
One line I want to say.
Yeah.
I think the perspective about Ayurveda, that is not clear. There are many misgivings about Ayurveda.
Exactly.
That needs to be dispelled. And another thing is, I think once these misgivings are dispelled, and the ignorance is dispelled, and the doubts about Ayurveda, if these are dispelled, I think we can understand the prospects of Ayurveda.
Thank you, sir.
Thank you. Thank you.
Thank you. Over to you, Dr. Madanji. Thank you so much, sir, and hope to meet you again in other forums.
Fine,
Thank you.
Thank you so much.
Thank you, sir.
To Dinesh and Dr. Rajvi. So we know Ayurveda, one formula does not fit all, but we have to create awareness to the masses regarding that there are, they cannot go themselves to any shop and buy the drugs themselves. And simultaneously, we also need to regulate the supply chain and probably give, a leaflet, which Dr. Ritu was saying regarding the side effects, even which we get with a simple paracetamol tablet. As in modern medicine, we do get, this list of side effects, what are there. But as Dr. Rajvi said, yoga is not a traditional medicine, but a way of life. Similarly, Ayurvedic medicines, we cannot expect, which you believe on sattvic system of living, to help when we are poisoning our body with so much of, junk food these days, and we expect we are having an Ayurvedic treatment and it will help. But cutting short, it was an interesting topic, and now I'll switch on to the next speakers. I invite Shalini Chawla, who's a dear friend, and Dr. Ritu Jain, president of our Gram Gynecological Forum, and Dr.
Thanks,
Preeti
Dr. Madanji. Yeah.
Shalini is a senior IVF and laparoscopic consultant with Max Hospital, Delhi NCR. She's General Secretary, Delhi Gynae Forum, South Delhi. She's executive member of IFS
thank you,
since 2020.
Yeah, Madanji, thanks. That's enough.
Okay.
I think let's take
Madanji,
forward.
you can cut through short, just
And-
shorten it. We go to the main topic,
And Dr.
right?
Yeah.
Okay. Dr. Preeti Chhabra, ma'am is a Delhi-based Ayurvedic consultant practicing for the last 30 years. She specializes in Panchkarma therapies, Ayurvedic gynecology, Agni Karma, and Jalu Kavacharan. She's pioneer in starting Suvarna Prashan in Delhi. She is Guru RAV, an autonomous body under Ministry of Ayush, Government of India, patron NISA, distinguished member of All India Congress, Ayurveda Congress, patron Arogalia, advisor Namo Gange and Indian Vedas. She's also faculty at Academy of Ayurveda Studies, New Delhi. She heads Northern Region Lok Ayurved, the Wellness Revolution. She's offering her services at the prestigious Sir Gangaram Hospital and Shri Krishna Super Specialty Institute of Ayurveda, Janakpuri. And she's also available on online platform called Sushen. She's been honored as the best Ayurvedic physician, conferred the title of Pranacharya by All India Ayurveda Congress, Outstanding Ayurveda Professional of the Year 2017, and Torchbearer of Ayurveda Scroll of Honor, Dhanvantri Award, and Corona Warrior Award, to name a few to her credit. Over to you, Shalini.
Dr. Shalini, you're on mute.
Shalini, mute.
Yeah. Sorry. Yeah. So, welcome, Dr. Preeti. As we have heard so much from Dr. Katoch about the basics, the principles of Ayurveda and the various medicines. So now coming to more specific, Dr. Preeti, like we all are as gynecologists. So basically coming to the main gynae problems, like if someone has, like basically I'm infertility specialist and we see a lot of problems, patients where the tubes are blocked, where there is endometriosis, where there's a fibroid or there is a male factor. So just to be more specific, I mean, does the Ayurveda has a role in treating these conditions? Maybe what is your experience which says, okay, this condition you find, like maybe treating PCOS you find much more beneficial. So just let us know about your experience in treating gynae patients.
Thank you very much, Dr. Shalini. And at the outset, I would like to thank the organizers, the society, for giving me this opportunity to, project infertility with the lens of Ayurveda. And my humble salutations to my senior, Dr. D.C. Katoch, and a warm welcome to all of you. Ma'am, as the experience goes and what I've learned from my gurus and seniors, we have very good role and the approach is very rational as far as Ayurveda is concerned. And if the house permits, I would like to share a small PPT. I might skip a few slides because they're too technical with Ayurveda, but I want to give a bird's eye view about what is the approach of Ayurveda towards infertility. So I'll share the screen if the house permits.
Yeah. Please go ahead. Then we have questions for you.
Yeah.
Yes,
Like
yes.
this.
Sure.
We can make her as co-host.
Yes,
She is co-host. She is co-host. She can.
Yes. Yeah.
Actually, Dr. Preeti, we have many questions. Maybe your PPT, gives a bird eye view, and
yes, the
the
questions may pop up more.
main one,
Yeah.
main one are solved there only. Yes, exactly.
Yes.
So Shalini, please, Dr. Rajvi, can she share her screen?
Ma'am, I'm not allowed
You
to
are
share
the
the screen
co-host,
actually.
Doctor. You are the co-host. You can share the screen.
Okay, ma'am, just a minute.
Yeah.
How to share the screen? Let's see. I did this. Yeah, ma'am, this is an entity. Can you all hear me?
Yes.
You can see
Okay,
it.
ma'am, this is an entity which is called Bandhatva in Ayurveda, and it's not that this problem was not there in the olden times, and our ancestors were not having such a problem, because if we have a
Can you put it on the
historical
slideshow
records,
mode? Because Dr.
pardon?
Preeti, can you put it on the slideshow mode? We are only able to see the first slide. Slideshow.
Okay, just a moment, ma'am.
Yeah.
Slideshow mode. Okay, ma'am, is it visible now?
No, it's still showing the whole screen with the slides.
Okay.
Yeah, it's
I'm
not on
showing the
slideshow.
slideshow. Yeah. From the currency. From the slide. Okay. Ma'am, is it visible?
No, it's still the same, but I think you can continue if it is not possible.
Yeah,
No,
please
ma'am.
continue. Yeah.
Just
Continue, please.
give me 1 minute.
We can see your slides, so you can continue.
You can see the slides?
You can
Yes,
continue.
you can scroll down. Yeah.
Okay. Is it visible now?
Yeah, it's moving. It's moving.
It's
It's
moving
not
now.
skipping.
Okay, ma'am. You can see this slide with the historical glimpse.
Yeah.
Hello. Okay.
Yes.
Yes, ma'am. First of all, I would like to acknowledge few of these slides are from the net only, because there was scarcity of time. So few of seniors and my colleagues, and a few slides are from my own. So if we go through the history, it's not that this is a new entity. This history is the testimony of the fact that the birth of Rama as in brothers. This is the first thing, Deve Pashya Chikitsa, which we call the spiritual aspect, or the out of the word aspect. I always say, and I always believe, where science and spirituality begins. So Rama and his brothers were born with the Deve Pashya Chikitsa, and Pandavas, of course, with artificial insemination and Kauravas, we know there was separation and incubation of totipotent cells. So these seem to be mythological, but these are not actually, and there was a science behind this. All our cultural practices, all our whatever we do culturally, even the smallest of the thing in our cooking methodology, they all have scientific basis. All the riti rivaj in our system, you talk about Kerala, you talk about Jammu, you talk about Gujarat, and even Northeast. So every tradition has a scientific base, just that we are not able to decipher, we are not able to see with those eyes, but they all have a strong scientific background and very logical. The more we learn about it, the more we know how ignorant we are. So, small glimpse about the male infertility, we call it Shukra Dhatu, as sir just now told, that these are the, the dhatus are the main constituents of our system. So, Shukra literally means semen, or virile sperm, lucid, which is lucid and clear in human physiology. Shukra Dhatu is a body constituent having reproductive
Preeti,
capacity.
you are not audible.
It is generally, pardon?
Not audible.
No, she is audible, sir.
She's audible.
She is audible.
Is it okay? Is my voice okay now?
Yes, yes,
Okay.
yes, yes.
Shukra Dhatu is a body component having reproductive capacity. It is generally equated with the semen on the ovum. Shukra Dhatu is described to be with the to be of two forms in the Ayurvedic textbooks. The one which is ejaculated during the process of mating, which is responsible for fertilization of ovum and thus embryogenesis. This is semen in males, the one which is formed from the predecessor tissue that fills the bony cavities or the Majja Dhatu. This in turn circulates all over the body, both in males and females. The first form of Shukra stands for the semen in general and for the sperms in particular, and the second form of Shukra stands for the hypothalamic pituitary gonadal axis of hormones that circulates all over the body. Now, Shukravaha Srotas, these are the channels of transportation of semen tissue, including the channels which help in formation, maturation, conveyance and ejaculation of semen. Shukra means semen and Vaha means the carrying channels, the srotas which or the ducts which are responsible for transportation or conveyance of the semen. So, according to Acharya Sushrut, which is all we all know is the father of surgery, there are two, the channels which carry the shukra. These are the vrishandus or the testes, and according to Acharya Charak, these are vrishin, the testes, and the shefa or the penis. There are many symptoms of vitiation of semen channels, which were delineated as clevata, which we call impotence, chirat prasek or delayed ejaculation, rakta shukrata or blood mixed with semen, and then is aharshanam, lack of erection of penis or disinterest in sex. Nacha jayate garbhata, conception does not occur or there is no progeny, even if the semen and ejaculation is proper. Rogeva clavum, that means the child born to the person having vitiation of semen carrying channels will have a short lifespan, will be ugly in appearance, and will not be able to carry on the reproductive function. Then Garbhapatati or Prasarvati, that means even if the semen or the sperm does fertilize the ovum and become successful in producing the embryo, the fetus will not live long and hence abortion or miscarriages occur. This means to tell that vitiated sperms or semen will fail to cause conception or will cause abortion, miscarriage immediately after conception. So this was the study was to the minutest level, and our acharyas or the sages, what we call, they have delineated all the pathologies to their intense to the last intensity. Now the broad factors of infertility which were defined as defective spermatozoa, defective seminal plasma, defective efferent duct system, sexual dysfunction, combined factors such as ASA, coitus position, etc. Then Atmajbhav, this is unexplained fertility, usually treated by Deve Pasha Chikitsa, which we call the intervention of the spiritual powers. And we all know these conditions: oligospermia, athenospermia, and then teratospermia. Then reto dosh or the different pathologies which are encountered or seen in the semen. There are many. There may be kshay. Kshay means there is deficiency or there is decline. Dushti means there is a lot of pathological conditions. It may be kshay, may be primary or secondary. Alp means less, and vishushk means dryness. And these are different terms: fenil, tanu, rukshata, vivarnita, puti, pichal. These are all technical terms of Ayurveda, which describe the pathologies of the seminal fluid or the sperms. Then how do we manage azoospermia? There are many herbal medication, mineral medication, and herbomineral preparations which are utilized in Ayurveda, as Sir has already described that these eternal herbs have immense potential, in the field of infertility, and day in and day out we are getting wonderful results and very encouraging results because we have been using these from times immemorial. And there are many interventional therapies also, as I already discussed, many biopurificatory therapies and procedures which go by the name of Panchakarma. And there is a one specific procedure in the Panchakar modalities only, which we call Uttar Basti, which I'll be talking about in a little while from now, which has very good results. And then we also take care of maturation and arrest by Panchakarma, Uttar Basti, and Shukra Janak drugs. Then maternal cell syndrome, we do Panchakarma, obstructive azoospermia, we do Uttar Basti, and many other modalities. And there are many researches which have shown that ashwagandha, which is a drug of choice in case of stress-induced infertility, then we have abragbasam, which has showed significant reversal of heat-induced testicular damage, and then shatavari grit, which has been found to be very effective in improving hypoosmotic swelling, indicative of improvement of sperm structural membrane integrity. Then swarn, very, very important, gold. We administer swarn in the form of ash, which is the gold metal is reduced to ash, and the particle size is so less that it does not cause any it does not affect kidney. In There's no adverse effect on kidneys, because Ayurveda is usually shooed off at that it has more of minerals, and it can lead to renotoxicity, which is not true, because these properly prepared bhasmas have a very small particle size, fraction of microns, which only have the catalytic action. They don't really stagnate and cause detrimental effect to the system. And administration of gold is also in very metered quantity, and that too for a limited time, which gives miraculous results, as have been many researches. Even a newborn hair and semen has gold ions. So the high fertility as well as high semen parameters of gold mine area were reported, and swarn or gold has shown significant improvement in the sperm count and motility without any correlation of its concentration. And this goes very well with the fact that in olden times, people who were using, even men used to wear ornaments of gold. And it was mandate for most of them to tie a tagadi or a waist belt of gold around their waist, and it was found that those people who wear tagadi regularly, they don't have all such problems related to infertility. So these traditional systems, they all have a science behind, because gold is very well absorbed through the skin. Skin, as we know, is the largest organ of the body, and it has the power of absorption and assimilation, like all other many other organs of our body. So this was a brief overview of the male infertility, and then we come on the female infertility. As on date, we observe that 40% of female infertility is due to lifestyle factor. There are many changes in our lifestyle, so that has caused a detrimental effect on the genitourinary system and the reproductive system as well. So Artha means the female counterpart of semen, and Artha in females has two components. One is Bijrupartha or the ovum, and one is Dushtartha or the menstrual blood, which is shed every month. The root of Arthava Srotas is Garbhashya or the uterus, and the Arthava Dhamni is vessels carrying the Arthava. Or if we talk about ovum, Arthava Dhamni can be the fallopian tubes. Garbhashya can be compared with uterus that help for the development of the fetus, and Dhamni can be compared with the arteries or the ovarian arteries responsible for the formation of Artha or the ovum, and uterine arteries responsible for the flow of Artha or the menstrual blood. So pathological changes occur in the body due to sroto dushti, or when there is blockage of the channels, or there is vitiation of the channels, or sroto sanga, etc. So if any injury occurs due to arthavasrotas, that leads to vidya lakshana, etc., this can call vandhatva or infertility, and mathuna asahishnuta and arthavnash also. There are many terms which define different types of infertility in case of females. Like we have one term which says kakbandya, in which a woman who has one child but the second time she is not able to conceive, and then is Annapatya, where the woman has not had even a single conception. Then Garbhstravi, where there are repeated history of abortions, or what we call today is bad obstetric history. Then Mritvatsa, where there are repeated stillbirths. Then Valakshat or infertility due to low bal or low strength. Then there is Ajat Ratsa due to Balyakal, where the mother is or of not the proper age. Then also we have this kind of infertility. So there are various types of infertility and the related factors which have been defined and described in Ayurveda to the length. Then this is a very important slide which gives us a very wide perspective about the Garbh Sambhav Samagri. So what causes fertilization and what causes the formation of an embryo. And there is a concept in Ayurveda which says Lok Purush Same. Lok means the body, human body. Sorry, Lok means the our external environment or the universe, and Purush is our body. So there is a lot of similarity between Lok and Purush, where we see if we want to bring up a tree or a plant, what all we require? We require the proper environment, we require a proper heat, we require a proper soil, and we require proper nourishment. And same is the case with the Garbh, where we need a proper Ritu, that means the proliferative phase, and Maitra is the healthy female genital tract or the healthy uterus. Then we talk of beads, we should have a proper good ovum, good quality ovum and sperm. And then Ambu, when we talk about, we should be having proper metabolic products, that is glycogen and hormone support, etc. So, according to the Lok Purush Siddhant, this is the Ritu Kshetra and Ambu Beach. These are the four primary prerequisites to for development of a healthy fetus. Then this is an elaborate slide which is very quite technical. I would be skipping it here as of now. And then there are very classical medicines which we used and which our acharyas have mentioned in a variety of stages. Like we have Shatabri, we have Mushali, then we have Falgrit, then we have different preparations. Not only single drug formulation, each medicine has a wide application, and it has the potential to be processed in a wide variety of methods for which they are useful. Then practically used drugs are, we use Deepan drugs first of all before going for even the purificative procedures, which are the carminators, and medicines which we use are Chiruvilvadiquat, then Nirgundyadiquat. These are all kashay or the decoctions. Then we have Pachan or digestive medicines, then Anulomam, which are carminators, then Lekhan or scrapping medicines, then Rajya Pravartak, which induce menstruation, and then we have Udvartan, which help to reduce the excess body fat, which is also one of the causes, as we see in PCOD these days. Then we have Bhatamil can meditate Then we have Takarpan, Snehapan, where we give buttermilk and medicated clarified butter or ghee for internal intake. Then Abhyangam, which are the massages. Then Uklesham, which proliferate the doshas. Then Vaman, as sir told, Vaman is therapeutic emesis, Virechan, again therapeutic purgation. Then Anuvasan, these are the different methodologies of enema therapies. And Uttarvasi, as I told you, this is through we insert certain medicines into the vagina and the uterus, all medicated oils and ghee and kadas. We do that as well, because these have been very, very efficacious in cases of Asherman's, in cases of tubal blockage, in cases of hydrosalpinx. We have got very good results with by using Uttarvasti. And then these are few medications and different permutations and combinations, compounds, single drugs which have been used day in and day out for treating such conditions. These again are a list of medicines. A few other drugs like Jirika Risht, Kumaryasa, we all know the Dashmula Risht, many people are using, Ashoka Risht, many people are using. They work at the grassroots level, and they have, their specific role in development of the uterine endometrium, as I told in Asherman's also. We have been using all these systemic drugs. So we have local therapies, we have systemic therapies, then we have local, dispersion of drugs at that particular organ. That also has a great role to play in ameliorating the pathology. And then we have different type of bastis. Bastis is a type of enema therapy, wherein we instill the medicated oils, medicated ghrithams, and medicated decoctions and into the uterine cavity and in the vagina, which have a very good role, and they help to detoxify first, and then help to create a normal endometrial bed. Now, another very important therapy is Nastya therapy, which I have been using day in and day out. Even it can be done at home also. So these are medicated, again, medicated oils and medicated rhythms and medicated kashayams, which are instilled through the nostrils. So Nastya therapy, because according to Ayurveda, we say Nasa hi Shirsodhar. Our nostrils are a doorway to our brain, and most of the times the problem lies in the pituitary, and we need to amend the hypothalamus pituitary axis. So Nasya of lukewarm Mahanarayan tail, this is also a very common drug. This stimulates the olfactory nerves, which in turn stimulate the limbic system and the hypothalamus, which stimulate the GnRH neurons, and they help regularizing the pulsating secretion and proper gonadotrophin secretion also. And these are the few of the modalities which have been found to favor conception, and there are many researches ongoing, and there are many research papers already published that Nastya therapy also has a very good role. It has a key role to play in regulating the reproductive system of our bodies. So there is Vata, as we told, this is one of the entity, the biological entity of the human system, Vata, Pitta, and Kapha. The dosh has to function properly, because it's very necessary, and taking care of every aspect of fertility. That Vayu should be in the proper manner. It should be in the proper. It should function in its proper manner. So that ovulation and ascending of the sperm through the female reproductive tract and fertilization, ejaculation, implantation, everything is governed by this Vayu, and that too in particular the Apan Vayu. So these should be in the proper. They should function in the proper manner. For that, we need to advise all such therapy. We all know that the complications arising due to the infertility management, including hormonal therapy, ovulation induction, and invasive diagnostic procedures, are huge. In cases of unexplained infertility, lifestyle modification and ART are the only treatment options available, but the success rates are less and highly expensive too. Ayurveda, on the other hand, looks deeply into the individual constitution and aims to enhance the functioning of the body systems that participate in the process of fertilization in totality. Systemic approach with the Ayurvedic principles are effective in managing infertility as an effective, natural, safe, and very cost-effective method. But further studies with proper research design are necessary, and they're ongoing as well for the scientific validation. Many of the drugs procedures have already been scientifically validated. I would like to add upon one of the questions which popped up in the previous session about the gut biome. Ma'am, actually, when we go for the Panchakarma therapies, it's not only the therapy. After that, we have this Sansarjan Kal, in which the patient or whosoever has had this procedure as a wellness treatment, because we advocate that it's not only in the pathological state that you need to undergo the Panchakarma process. Ayurveda is more of a wellness medicine. Illness comes as a second, as a second, goal or aim. Because when we define Ayurveda, it has two major aims: Swasthasya Swasthya Rakshanam and Aturasya Vikar Prashmanam. Swasthasya Swasthya Rakshanam means to take care of the health of a healthy individual, and the second aim is to take care of the disease process and take care of the disease, to take care of the patient. So when we talk about Panchakarma, after the Panchakarma or the biopurification, we also have to go for Sansarjan, which ensures that the gut biome is resumed and a healthy gut bacteria is maintained throughout. So, and there has been studies in Jamnagar, which is one of the ACE institutes, Gujarat Ayurvedic University Jamnagar, wherein the vomiters or the purged out material were analyzed, and it was found that it does not have any detrimental effect, and there is no loss of gut biome post all these therapies. So these all have been scientifically validated, and there is nothing to worry about it, because it is not that today mankind has been, inclined toward Ayurveda therapies. These therapies have been conducted and they have been utilized since times immemorial, and as per the history of Ayurveda, they have been used for the last 5,000 years. So there's no question of, we just have to follow and we just have to believe in the science, and the science gives us all the confidence and the best of the results. Thank you all for your patient hearing, and I open the house for your questions, and I try my level best to answer your questions to the best of my capacity. Thank you so much.
Yeah. Thank you, Dr. Preeti. In fact, I have lot many questions.
Okay.
So first of all, it was wonderful highlighting so many things in this small presentation, just giving us bird eye view. So first, relating to male infertility, I want to ask you, like you said, there is a treatment for aspermia and Sertoli cell syndrome. So as per modern medicine, it is really difficult to have some treatment, because in Sertoli cell syndrome, we understand that spermatogenesis is not happening at all, and same for aspermia. So how these conditions are treatable? Because when we do FNAC in these cases, we don't find any evidence of spermatozoa. So how does Ayurveda help in that?
You're muted. You're muted, Dr. Preeti.
So Dr.
Dr.
Preeti, we are
Preeti?
not.
Yeah.
Dr. Preeti, you're not audible.
Ma'am, am I audible now?
Yeah.
Yeah, okay.
Please.
Ma'am, in Ayurveda, there is a theory that all these dhatus, or whatever are the, constituents of our body, right from whatever we have, like food is the basic nutrition, and food is transformed into aharas, which further, leads to formation of ras, rakt, mans, med, atsi, madhya, and shukra. So shukra is the last dhatu, and beyond that we have oj, which is the terminal, essence of our dhatus. So there is some arrest somewhere where in which the end dhatu is not being produced. So we work upon, first of all, the shodhan prakriyas, or the body detoxification and body purification processes. And after that, we go for the specific dhatuvagni boosters, because we have this concept of Panchamahabhut. And then we have this concept of Agni, which is the Jatharagni or the Kayagni, which boosts all the Panchdhatvagnis. We, focus on those Agnis, and then if there is dearth, or if there is loss, or if there is lowering of any of the Agnis, we work upon boosting of those Agnis, and subsequently these dhatus also get into the proper shape and manner. First of all, those biopurification and detoxification procedures, thereupon we work upon the root cause, and we give certain medications. And of course, I would like to mention here that this is science, and science is something which is dynamic, which is not static. There are certain medications, there are certain herbs, like if we talk about one herb called Shivlingi, which has achintya prabhav, achintya shakti. And drugs like Shivlingi and many more drugs, they work at a level which is beyond our imagination and beyond our thoughts. But we do find very encouraging results with these drugs. So there is a whole methodology. We don't give 100% surety in all of our cases. We do try our level best, and most of the cases respond very well.
Yeah, Dr. Preeti, I am also an IVF specialist, but for these conditions, we often resort to, donor sperm. So that is why I put this question to you specifically. And what about, you said Abrati Bhasana for varicocele, like when the temperature of the scrotum is increased. So there also we are able to get results.
Ma'am, Abrak Bhasma has results, then Trivanga Bhasma is another medicine which has very good results. And for varicocele in particular, I'm using, you'll be surprised to know, I'm using leech therapy also. Leech therapy is one good methodology which is being used for varicose veins, but I am using it out of the box for many other conditions which are not documented too much, but to my great, amusement and this, these are giving very good results. Leech therapy, leech is one good natural surgeon which which sucks or which filters the blood, the and whatever stasis is there, and it helps in neovascularization and taking care of, it sucks the impure blood. That is the beauty
Dr.
of
Preeti,
leash therapy. So whatever temperature rises there, and due to stasis of the blood because of varicocele, and there is observed that there is a reduction in the, the worm like feel, or the bag of varicocele that is also there, and there has been reverse also for this particular condition varicocele. We give Virachin also, and I do leech therapy for varicocele patients as well.
Dr. Preeti, since you are at Apex Institute, Gangaram Hospital, so you must have some, papers on your own work. So at the end of session, we would like you to share that with us so that we have something, okay, that there is some scientific literature which we can assess to, because we, as Dr. Rajvi said, we are the different sides of the river. We go parallelly. Ayurveda is way of life, and we are more into curative medicine. But what I want to talk about to you is like decreasing ovarian reserve nowadays. What I find most often, it is like the test which we recommend, like anti-Mullerian hormone or LH, E2. So the same tests are recommended by you. Is it like the same tests are there in Ayurveda, or it is an overlap to diagnose this PCOS, poor ovarian reserve? Yesterday, because of this session, I was going through, so I found that your method of diagnosing PCOS is almost the same as we do. So, how do you go about it?
Ma'am, the methodology is the same because we need to work on the similar parameters to give better results. And these days, the patients are also very intelligent. They come you on the reports. They want themselves to be not to be cured them for their body, but they want the good reports in their hands. They come and put you as a chat. They give you the reports. Okay, can you do this for me? So low AMH level we have worked upon them for very nicely, and this thing. I've got very good results with Nastya therapy, which I just told you. Along with the medication, we have been using Nastya therapy, and that gives very good results in improving the AMH levels and ovarian research. Again, I would like to mention here, just as I told, we do go for Panchakarma therapies and biopurification therapies. We do the same in case of low AMH levels also. And recently, one of my patients, she was attending a OPD at AIMS, New Delhi, and she came to me with low AMH levels. Now it has improved, and now we are treating her for hydroxychloroquine. She has been treated with, she's being treated for hydroxychloroquine disease. Her AMH level has improved. She's just 32, married for almost 8 years now. Not 8 years, yeah, yes, 8 years
Yeah, in PCOS, we are
with
often
no
worried
issue.
about ovarian hyperstimulation when we give them gonadotropins or some oral medications to improve the, folliculogenesis. So, in your therapy, there is this sachara to remove excess follicle, the small and the medium size. So, just to integrate two therapies, I wanted to know you, when we are having a patient of ovarian hyperstimulation. So, can this Chara therapy, or can we take your help to take care of this OHSS, ovarian hyperstimulation syndrome?
Yes, ma'am, we do that as well, and this can be very well taken care of with, again, Panchama therapies, which is, we do Matra Basti in such cases with medicated oils, and we have got very good results in such cases also. And PCOS is one thing which has been very well taken care of with Ayurveda, only with oral therapies also, and
Yeah,
like a
that's
slight weight reduction can be done with Ayurveda. and then lifestyle modification. Of course, this change in the biological clock because of all these day and night shifts and jobs. Such girls and such young women are more prone to get PCOS. So lifestyle modification has given a lot of response, along with, of course, the medication.
Yeah, thank you, Dr. Preeti. Because in modern medicine, also, like for 6 months, and as a part of PCOS treatment, we say that lifestyle modification, detoxification, and having the proper diet and exercise has the main rule. And this anulom vilom, which you say, clears the nasya part also. So there is some sort of integration which we are still failing to recognize. There was a mention in your talk about treatment of Asherman syndrome with the medicated oils and medicated ghee in utero and in vagina. So I wanted to know a little more about it, because we talk of, in the hysteroscopy, metroplasty, opening up the cavity of the uterus, or doing some inserting some stem cell or PRP, the platelet rich therapy. So how does this ghee
Yes.
and medicated oil really help in rejuvenating the endometrium, which is really damaged? And do you workup for tuberculosis in these patients? And how are the results about?
Ma'am, Asherman's, I've got very recently. I've had a patient in which I did Uttar Basti for 3 cycles. We do it post menstruation, alternate days for 5 days every month. And to my great surprise, the very second month, the patient came with a positive. She was not having a cycle. Before the second cycle of this Uttar Basti, she came and told me that she had spotting this time, and the third cycle she had a normal menstrual cycle, which she was not having for the past 6 months. So we have again, we do it in the same manner. We do it with the IUI cannula, and we insert in a very minute dose these autoclaved medicated oils and ghee, and they act as a nourishing substance to the local endometrial tissue, and the endometrium proliferates and it grows and the Asherman's is taken care of.
So it was very nice knowing that, like, uh, you too take care of everything, like everything is autoclaved and post menstrual. All these things, they do have some integration somewhere. And since you said that your patient responded, it is so nice to know that, like, there is some other therapy to tuberculosis, this Asherman's also. So now I have this thing, why we wanted to integrate, because we know in PCOS it is the lifestyle and detoxification. There is another condition which bothers us is endometriosis, where we know that females who we typically say are A-type personality, or the one who are in cities, they have more, or the kind of food they have. And endometriosis bothers us so much because it keeps recurring even after surgery and removing it also. So, do you have anything which is, as a wellness or preventing the occurrence of endometriosis in your system?
Ma'am, there's a concept in Ayurveda which says that Ritu Sanshodhan should be done periodically. That means we all, as healthy individuals, should also go for a detoxification at periodic intervals. Because it's not only that we discharge our normal feces and urine and we are detoxified. We have so many toxins in our body, and they accumulate. They have a seasonal variation also, and so the concept of Ritu Sanshodhan or seasonal biopurification is recommended for all of us. So that biopurification is very important, and
Okay.
but there is a particular regime which all menstruating females and all pregnant females should follow, which has been obsolete. This concept has been obsolete, which we should have been following, because if we go beyond this and if we don't follow such regimes diligently and religiously, and we always go haywire, then our systems respond in the most erratic manners. So this is one thing. And again, endometriosis, I can share the report of one of my patients in the group as well, that I went for again this offbeat therapy. I did this leash therapy on her pelvis, and she had deep infiltrating endometriosis, which was not being treated. operated once. This girl had a second marriage, and she was very skeptical whether she would be able to conceive or not. So before plunging into the second relationship, she went for a surgery for her endometriosis, so that she's able to conceive whenever she gets married next. So she again had the same trouble, and she came to me with a report of deep infiltrating pelvic endometriosis, and she said, I won't be going anywhere now. Whatever you want to do it with Ayurveda. So I said, okay, let me give you a chance. And we again went for 6 to 8 sessions of leash therapy, which was spaced at 1 week each. And now she has a baby who's 1 year old, and there is no evidence of endometriosis. There was no evidence of endometriosis in her ultrasound report. I can share the report to you and the pictures of leash therapy also on the group.
Yeah, I would like to definitely, Dr. Preeti. And other thing which bothers me often is like for unexplained infertility. And like, what do you have in Ayurveda? Is there a treatment for that also, or detoxification is the mainstay of the treatment for those patients?
That is the first line of treatment. And after detoxification, we have many. There are many. Ma'am, there's another concept in Ayurveda which is not there in any of the sciences, which goes by the name of science or the rejuvenation treatment and Bajikaran. Bajikaran is all related to raising and developing a healthy progeny. There are loads and loads of recipes. There are loads and loads of what to call both food recipes and recipes of the medicines which increase the reproductive health and the reproductive power of the individuals, both male and female. So after going for the line of treatment, which is the panchakarma or the biopurification or the detoxification therapy, we administer these recipes and we explain the way of life, what they should be, what the couple should be following, what should they be eating, what medication and what tonics they should be having. These are all basically potent tonics which are given, which are a combination of herbs and herbomineral preparations which we administer. And rest all is we have to surrender somewhere to God as well. We try our
Yeah,
level
yeah.
best through these methods.
So as I understand, Dr. Preeti, Agni, you said is food basis of all the disease, and you try to cure that and do panchkarma for detox and other medicines which are individualized. In one of the treatment of your PCOS is Atibala, which has a role of, does it has a role in preventing the recurrent miscarriages also? Because somewhere everyone fails. No, we also try our level best for everything, and that is where we restore back to the holistic approach, change your lifestyle, change your way of living, eating, exercising. So I read
Ma'am, like
about this Atibala. Yeah.
ma'am, there are many not as a single drug, but it can be given as in combination with other drugs. And in case of bad obstetric history, stillbirths, and all such clinical conditions, we have a very good supportive therapy. Just like you have injectable progesterones. Now, in our cases, we give Matra Basti, which is the administration of medicine through the rectal route. So
Okay.
the medicines are also administered through the rectal route. And again, there many patients are there where there are chances of missed pregnancies, because the women are so dreadful. They dread pregnancy so much that they might have recurrent abortions and stillbirths and also those happenings. For those conditions, we also give them a good support through our medicines and, of course, this Matravasti and other Panchkarma therapies.
Dr. Preeti, I just have one
Dr.
question.
Shalini, I just finished my
Yeah.
questions. Sorry, I took little more time. Dr.
No,
Shalini, please
that's
carry
okay.
on.
Yeah, Dr. Ritu, the questions were same. That's not an issue. The only thing is, Dr. Preeti, as you said that you have a treatment for low ovarian reserve or for azoospermia. So my only question is, like, is there a time limit that you tell your patients ki, okay, see this treatment, you have to take it for 3 months or 6 months? Because, we have a great fears in our mind that the patient is already with the low ovarian reserve, and the patient goes to the Ayurveda and says that, and you say that your treatment will work. By any chance, suppose your treatment doesn't work, then we really fear that the biological clock ticks, and suppose the patient is already 38, 39. So maybe are we losing that important time where the ovarian reserve will further go down? So what time period do you say for these kind of patients?
Ma'am, we never make false and tall claims. It has to be in the benefit of the patient and the system as well. We always give them a time, because age is one factor where we cannot, pull down things. We always tell them that this much time, maybe 6 months to a year, you can give yourself, and if you see clinical improvement, you can continue the therapy and you can get results. But usually within a year, if the results have to happen, they usually happen within a year. Beyond, if the patient insists on going for the therapy, then we again indicate periodic panchakarma therapies and periodic vajikaran yogas, as I just mentioned.
And simultaneously, like if we integrate Ayurveda and like maybe the patient is going for IVF, then are there some evidence or there some studies that both can be
Yeah,
given
they
and
can
they
go.
don't hamper?
Yes, ma'am.
They can
Yes,
go.
ma'am. They can go hand in hand. As we all know, there are so many IVF centers mushrooming all around us.
Yeah.
So I have been getting referral from a few of IVF centers also for these particular Uttar Basti therapies and other therapies for the management of maintenance and clinical conditions like tubal blockage and all, because these both the systems can gel and blend very well, as far as I feel, because we ultimately the goal is to treat the patient with the best of the results in a stipulated time. So if we can gel together, if we can go with an open mind, both the streams, I think we can help mankind come out of this plague.
Yeah, yeah. Nice thought. And that was the whole purpose of integrating. And I really thank Dr. Rajvi to give a forethought to this and, plan like this. It was not possible without her vision to integrate the things like this.
Yes, I
Thank you, Dr.
wholeheartedly thank the
Preeti.
forum, Rajvi.
Dr.
Thank you,
Shalini,
Dr.
yeah, Dr. Shalini, you're on mute. You're speaking something,
Yeah,
but you
Shalini,
can't.
please carry on if you have anything.
Yeah. No. I think Dr. Preeti has sorted out most of the questions. So it's very important. Dr. Rajvi has given this platform to know each other views, like about the Ayurveda, and also, because the general tendency is that when a patient comes to us, we normally, disregard that thing. But now this has opened our eyes too. We are much more aware of your therapies, and we are more wiser now after hearing to you. And thank you so much, Dr. Preeti, for clearing our doubts. And over to Dr.
Thank you everyone for hearing.
Thank
And
Dr. Dinesh for his presence and his, giving us an overview, and Dr. Rajvi and Dr. Preeti.
Thank you, Dr. Riti.
thank you all.
For organizing.
Thank you, everyone. I hope, are there any questions from the audience or we are done?
There is a question whether Ayurveda can work for DNA, improving sperm DNA fragmentation.
Dr. Preeti?
Ma'am, we can always try out. We haven't got many research in this, but we can always work upon these issues as well. As I told you, we don't make any false and tall claims, because today's world needs validation, scientific validation. But we, in person, we totally believe in the science, because these recipes, these yogas, these medicines have been time tested. As we say that Ayurveda is direct from the this from the Vani of Brahma only, the creator. So creator cannot guide us in the wrong way. So we have not tried on these issues, but definitely in times to come there can be many researches. There's a lot of scope actually.
Yeah, just one question, Dr. Preeti. I have one more question for you. See, all these terminologies that we are using, that the patient has low ovarian reserve, endometriosis, these are the diagnosed patients,
Yes.
diagnosed either on ultrasound and all. Suppose a patient comes to you first without getting all these investigations done. So a patient of infertility in general, then how do you go about that patient? I mean, what
Family history
investigations,
first of all.
like,
Ma'am,
what investigations would you write?
Ma'am, this is actually very rare. Practically speaking, always the patient comes to us with a big I've been through so many doctors, I've gone through so many investigations. What can you do for me? This every case poses a challenge for us.
Because probably you are at Gangaram, no? We wanted.
Yes.
And I want to thank Madanjit also for coordinating the session well. Thank you, Madanjit.
Welcome, ma'am. Hats off to you. We are joining from a different time zone. That's early morning there.
Yeah.
Because I always wanted this thing to integrate and to know, but we always say is ki yoga, ye, and where it comes from, we often ignore. So it was important for us to know the way of life.
From both the discussions with Dr. Dinesh and Dr. Preeti, it's only one thing which I want to drive the point is that we just not treat the disease, we treat the patient holistically. So whether we integrate Ayurveda into our practice or not, yes, most of the doctors of allopathic medicine I've talked about about Ayurveda, this is that they are open to integrated medicine, provided we have more of evidence and research available to us, because we have been trained to do evidence-based practice. So I mean, if we have more studies, which we can jointly probably do, then yes, we'll be having better health for all in the near future.
Thank you, Madanji. Thank you, everyone.
Thank you, everyone.
Thank you for making me a part of this group.
Dr. Preeti, how can we get your, data, or maybe just like, you've treated, suppose, 10 patients of male infertility, so many benefited.
Ma'am, there are so many researches online. I can give you a link. You can access those researches, and all the Ayurveda universities and all the Ayurveda colleges, they are uploading their researches online. One of my seniors,
your personal data, not the research, your personal data and experience.
Okay.
Yeah. And especially those conditions where it has worked the most.
Shalini, send your patients to her. You will have the first data.
Few case studies are there. I'll definitely share them with you.
I said, Shalini, you send her the patients. She will have your first-hand data. You will have the first-hand evidence.
Oh. Yeah, true. Yeah, definitely.
No, especially Sartori cell-only syndrome and those kind. It'll be very interesting to see a change, even if we start with few cases. Because we're totally changing. Yeah, so it'll be nice to start some collaboration.
Okay, sure, ma'am.
All right. Thank you, everyone.
Thank you. Thank you. Have a nice.
Bye-bye.
Bye.
Thank you, Dr.